Okay, so we're in part two, or chapter 5B, if you will. We're looking at the government's role in technology diffusion. And one more time, we're looking at some of the regulations for medication. How are we controlling the drugs coming from overseas? How are we securing supply lines? And what are all the regulations? We seem to be hindered by regulations and not so much worried about the acquirement of some medications, which is a challenge for some people. It's important to understand that while we're looking at some of these categories, we have laws and amendments and acts that follow. And I know that you'll find them when you're reading, but you'll be amazed that we have a thing called a medical device amendment, and it was passed in 1976. So that might be older than all of you. That's extremely interesting because, as we know, medical devices have changed drastically, probably even in the last 5 years compared to what was happening in 1976. We also have the different certification of need, how a patient would guarantee that they actually need some sort of technology, medical technology. And that was a Health Planning and Resources Development Act of 1974 that stated that in order for people to have certain rights and regulations for different medical devices, they needed to have what was called a certificate of need, or what they referred to as a CON. And then there were some, the Omnibus Budget Reconciliation Act of 1989 was designed to help R&D. So again, from 1989, we're looking at how to fund and care about some of the different research and development that's happening in medicine. So it's a little bit frightening if you take a look at some of those things. When we get to the impact and here's some of those informations, the certificate of need, research technology. The impact of medical technology is the impact on quality of care, and we're believing that the quality has increased. The impact of quality of life, where people who are living longer are doing so at a higher quality of life. And then how is it impacting health costs? One of the questions that you have to answer this week reflects that information. And so I want you to think very clearly about what is happening as far as the impact on healthcare costs goes towards technology. Is it a benefit? Is it a negative? Don't just take the points from the textbook out directly and quote them. Think about it and put some information on there. How much does it cost to acquire the new technology or equipment? How much does it cost to train the physicians or technicians? How is the equipment maintained, supported? Is there any special requirements for the technology, whether it's bandwidth or cloud space, or does any of the technology require space in a patient's house? And then based off of all of this, how does that impact access? And always, that's our question, right? How does it impact access? So those are some important things to keep in mind. Mobile equipment can improve geographic access. However, one of the best things is that there was a car battery ripped from cars in South Africa, in order to help incubators and defibrillators work. And the reason why they used car batteries instead of some of the technology that we have here is because the folks in that country were able to fix and repair that type of thing and had replacements or substitutes at hand, whereas they would have to wait. It wasn't as though you could keep a battery on hand and just pull it out whenever you needed it, because it's portable, it goes from area to area, and they actually die when not in use. So something really important to keep in mind. What's really important when we start to take a look at some of the new technology that's been used in medicine, we have to be very careful about where the cost is, who is absorbing the cost, the accessibility. And the truth is, as with everything, there's a cap, right? As the cost goes up, the benefit is exceeded. And so we want to make sure that we keep an eye on that and see what's going on. The cost benefit analysis is going to be a big information breaker, if you will. So taking that into effect and consider these 4 assumptions in each and every time. So from that standpoint, we then get into the what's happening with health technology assessment, who's using it, and what's happening. What's the expectation? So as you know, in the world of medicine, we have everything needs to be evidence-based. This is interesting because it leads to a standardization for people to understand what can help or what can prevent certain diseases, problems, or what treatments are best. The challenge, though, is that not everybody responds the same to every sort of treatment. And so when we take a look at this standardization, some things that might be unique and innovative as far as care and treatment goes are not looked at or not supported, and certainly not funded because they aren't evidence-based considerations. So that sort of works both ways. I want you to think about that. If a thing, a treatment, a care plan were to become evidence-based and be able to be some sort of standardized program, how do you think it began? It began somewhere by somebody doing something maybe rogue. So that's something to really take into consideration. As we get into the next level, the 7 ethical clinical research requirements, you're going to need to know this as far as public health people go. You will maybe never do a true scientific study in the way of patients as far as what we call positive control all the variables, predict an outcome, do some controls, and then look at the analysis. But the situation is that we need to really pay attention and see what's going on. Remember, there are 2 types of research: quantitative, and that is the pure scientific research, and there's qualitative. And qualitative, while not considered pure science, really tells the story. And as an exercise physiologist in my past practice and all of my other degrees, we were sort of beat into our brains about, you must have control of all these variables. This is the only way this works. This is what happens. And then as I got into practice and I was doing cardiac rehab and I was working with more and more patients and I was doing then traumatic brain injury rehabilitation with people, I started to see that some of the things that were considered scientific-based or evidence-based medicine were not working for people, and that some other things that were maybe what would be considered out of the box, I would think creative or innovative, and some people would say negative, and nobody would pay for it, are problematic. I also believe that we should front load things, and what some people call CAM, or consider what that stands for, which is complementary and alternative medicine. NIH even has a whole section on their website about CAM and how effective it is. So we need to really start to pay attention to some of those things and make some good questions about that. The next thing is that when we start to, take a look at some of this reform and what's happening, I wish that I could give you some strong answers and real different things that are going on. But, the quote from our textbook is that the United States has experienced the effects of President Barack Obama's Affordable Health Care Act and President Donald Trump's pledge to repeal and replace it. And so that's pretty much all I can say. Bits and pieces, trade-offs, political favors, all of that goes into play whenever we start to think about this. And I guess we as healthcare providers and people who are taking this as our profession need to consider that political effect of it. So thanks so much. Good luck.